Hello, my name is Sejun Ho. I'm a medical student in the University of Calgary, and our team is here to explain vitamin A deficiency. Ophthalmology and GI have a very important link. Different diets can alter the composition of the gut microbiome, and some of the newly introduced population of bacteria can produce proteins that act as inflammatory markers. This cascade of systemic inflammation can affect the eyes if they have a similar uh, proteins with the markers. The lack of digestion and absorption of certain nutrients by the GI tract, such as vitamin A, can lead to deficiency for the eyes as well. So understandably, vitamin A deficiency injures the eyes and can be brought upon by the problem in the GI tract. So as its name suggests, insufficient vitamin A to maintain proper ophthalmic functions is the definition of vitamin A deficiency. The normal range of vitamin A in the body is 28 to 86 milligrams per deciliter. Deficiency is only apparent after prolonged and only after it gets advanced, because the liver contains large storage of vitamin A. So even if the GI tract cannot absorb the vitamin A at all, the body is not immediately affected. So before we move on, let's observe the anatomy of the cornea and the conjunctiva, which is a very relevant structure in the eye with regards to vitamin A deficiency. The cornea is composed of 5 layers: the outermost epithelium layer, the Bowman layer that anchors the epithelium layer, the stroma, which is the thickest middle part of the cross-sectional cornea, the Descemet's membrane, and finally the innermost endothelium. The conjunctiva is a structure that overlies the sclera, which are the white parts of the eyes, and it protects the eye from external insults. The conjunctiva also is one continuous layer from the sclera bordering the limbus all the way to the inside of the eyelids. Vitamin A deficiency combined with metaplasia and keratinization of mucous membranes leads to the alteration of immune system, which then attacks the eyes themselves. Factors that render an individual more vulnerable to presenting with vitamin A deficiency include prolonged starvation and unbalanced diet, especially in South or East Asia, where the rice is the main component of the meals, celiac disease, cystic fibrosis, pancreatic insufficiency to digest the material, duodenal bypass, when the duodenal is such an important site for mixing the bolus or the food material with the bile salts. Connecting the stomach directly to the small intestine would bypass all of that and prevent a thorough digestion of vitamins for proper absorption. Cirrhosis that impede the flow of bile into the GI tract, and bile duct obstruction for the same reason. Symptoms and signs of vitamin A deficiency include impaired dark adaptations of the eyes. This is a key observation you can make, or a key point that you should take note on when a patient tells you their history. This is also called night blindness or nyctalopia. Xerophthalmia is the abnormal dryness of the anterior surface of the eye on the conjunctiva and the cornea. Beetle spots are found on bulbar conjunctiva, as you can see below, and they are superficial foamy patches. hazy cornea, and corneal abrasions are seen in advanced cases of vitamin A deficiency. Differential diagnosis of vitamin A deficiency includes hypothyroidism, allergic conjunctivitis, dry eye syndrome, retinitis pigmentosa, and chorioretinal dystrophy. So do a complete and thorough ophthalmic history, asking for any ocular conditions and surgeries the patient may have gone through in the past. Do a diet and nutrition history and any symptoms related to the GI tract, like bloating, diarrhea, ill-colored stool, oil mixed in the stool, etc. Do a pharmaceutical history and developmental history, including growth rate and bone development. Slit lamp exam, pay attention to the cornea, conjunctiva, and the sclera. Investigations of vitamin A deficiency include the rod scotometry and electroretinography, because the night vision is impaired due to the rods being affected the most from vitamin A deficiency. Treatment of vitamin A deficiency includes diet modification, eating a lot of dark green leafy vegetables, carrots, deep or brightly colored fruits, yellow vegetables like squash and pumpkin, and liver, egg yolks, and fish liver oils may alleviate some of the symptoms and supplement the body with more vitamin A. Supplements of vitamin A, called palmitate, taking 200,000 units as a prophylaxis for high-risk individuals, may be appropriate. Vitamin A palmitate, not as a prophylaxis, can be taken 60,000 units per oral once a day for 2 days, and then 4,500 units per oral once a day. And if there's vomiting or malabsorption, 50,000 units for up to 6 months, 100,000 units for 6 months to a year, then 200,000 units from then on to adulthood for 2 days. Prognosis of the deficiency is good with treatment and supplementation. There's increased morbidity with the progression of blindness. So hopefully we were able to show you that vitamin A deficiency is a problem in both the ophthalmology and GI realm. And here is a summary slide with everything we've talked about with regards to vitamin A deficiency. And here is the reference. So thank you so much for watching this video.